Let's go over CPR. It's one of those skills where a lot of people will forget how to do it because they don't do it often enough. So it's important to practice this skill enough so that you get it into muscle memory so that it's easy to do the skill, easy to recall what you're supposed to do. We just covered body systems, and this is a situation where the circulatory system has failed. So maybe somebody's had a heart attack and the heart tissue actually dies, or maybe they've gone completely into cardiac arrest where the heart stops beating altogether. In that situation, let's just look at cardiac arrest for a sec. The heart could still have electrical activity to it. So in that case, if an AED was available, we would use it first. But sometimes you don't have access to an AED, and in that case we would use CPR to manually pump the heart. There are situations where an AED can't be used because it doesn't detect any electrical activity. So asystole is where the heart has no electrical activity whatsoever, and if an automated external defibrillator can't detect that arrhythmia, it won't allow you to shock the heart. There's no way to override it, and that's another situation where you would have to use CPR and manually pump the heart. So sudden cardiac arrest is the leading cause of death in the United States. So more than likely in your lifetime you may have to use CPR on somebody, and more than likely it's going to be somebody that you know. So you don't want to get into a situation where you can't remember how to do it. So you need to practice it often. Risk factors that you can't control: heredity, so you may have genetics that predispose you to certain cardiac or heart conditions. Gender plays a role in it, and so females tend to have single vessel disease. So when they have a heart attack, instead of having multiple coronary arteries clogged, they may have just one, where a male tends to have all of them clogged. They all clog up, and they'll have the classic signs of having a heart attack, like pain in their chest area, especially on the left side, or pain radiating or numbness going down the left arm. Females don't always get that, and it can be hard to detect, and so they end up having a heart attack or going into cardiac arrest because they didn't notice the early signs of a heart attack about to happen. So that's how gender can play a role, and that's why more females die of cardiac arrest with their first heart attack than men do, because they just don't notice the signs and symptoms. They think, oh, I've just got the flu, I'm just feeling bad. They don't go to a doctor because they don't think it's heart related, and they end up dying from it. Age, obviously, these are all things we can't control. Things we can control: smoking, high blood pressure, high cholesterol, diabetes, being overweight and obese. All of those are things that you can control, either through diet or changing your habits or medication. The cardiac chain of survival: well, first we have to recognize that a condition is present. So this goes back to that difference between men and women. Not noticing that they're having a heart attack often leads to cardiac arrest in women because they don't have the classic signs. So we need to be able to recognize the signs of a heart attack and the actions to take. And so you'll notice here that CPR is listed before defibrillation. So this isn't a list of priority, what gets priority. It's just availability. A lot of times you won't have an AED present, so that's why they're listing you do CPR until an AED is ready. That's what defibrillation stands for. So we recognize that somebody's having a heart attack. We recognize that they need CPR because they're unconscious, unresponsive. That would be the situation where they've gone into cardiac arrest, they're unconscious, unresponsive. We start doing CPR, until the AED is ready. And once the AED is ready to go, it's going to get priority now over CPR. If it's already set up, easily accessed, and you can do that, you would do CPR until it's ready and then use the AED. Once CPR or an AED is used, or both, then you have to have advanced care. So you're going to have to go to the hospital. EMTs are going to have to show up to take you to the hospital, and you'll have post-arrest care. So that's what the cardiac chain of survival. You got to recognize, you got to take action, you got to give the appropriate skill. That would be CPR or use of AED. Then they'll have to, EMTs will show up, they'll take over, and then they'll take that individual to the hospital where they'll have to stay until they get better and they're treated for their condition. So performing CPR. So there are a lot of different organizations that teach first aid skills. And this class is a wide range. It's more of a literature review. We've looked at American Heart. We've looked at American Red Cross standards, ECSI, which is a Canadian version of that, which tends to follow what American Heart, American Red Cross do, and even EFR, which is more of an international. So this is the steps that almost all these organizations use because they're simplified and they're easy to follow. That's the reason we're following them. So you want to check the scene, mainly so you don't become a victim yourself. And then once the scene is safe, it can also give you information about what's going on. So you size up the scene, and then you need to check the victim. And you're checking for two things. You're checking for responsiveness, and you're checking for breathing. If you determine that the victim is unconscious, unresponsive, and not breathing, the next step is to call 911. And you want to tell them that. Hey, I've got a victim here that's unconscious, unresponsive, and they're not breathing. Telling them that information is extremely important. And they're going to ask you what your location is, and they're going to ask you about the victim. But relaying that information quickly will help them understand how severe the situation is. So now we've called 911, and now we can begin to give care. And so if the care that we're giving is CPR, we start with 30 compressions first, followed by 2 rescue breaths. Now, you may have seen hands-only CPR where they're just doing compressions. That's for the untrained person. For this class, since you're going to be trained, 30 compressions followed by 2 rescue breaths, and you keep repeating that. So if you're alone with a child or alone with an adult, the order of the steps is a little different. And this goes back to body systems. Remember when I mentioned that the leading cause of cardiac arrest in a child or infant is a respiratory emergency? Well, that's why there's a difference between the skills used or the steps used for a child or an infant versus those for an adult that's alone. So let me give you an example. If I walk into a room and there's an unconscious, unresponsive adult on the floor, I'm going to follow these steps that I just talked about. If it's an infant or a child and I walk in and I have no idea why they're unconscious, unresponsive, I'm going to provide 2 minutes of care first before I call 911. Because more than likely they have choked on something that's caused them to be unresponsive and not breathing. So if I start doing those compressions, that object may pop out. That's essentially unconscious choking skills. 30 compressions. If I don't know why that child is on the floor, I'm going to look for an object in their mouth after I've done those compressions to see if it's popped out. I'm going to go from cheek to cheek to try to scoop it out. I don't want to do a blind finger sweep because I might poke it back down into their airway. And then I'll do my 2 rescue breaths after I get that object out and see if they still go in. And if they don't go in, then I know there's a blockage in there. And I just keep repeating that. 30 compressions, looking for an object, try to remove it, 2 rescue breaths. And keep repeating that. So that's why there's a difference between infants and child versus an adult. An adult, more than likely, if they're unconscious, unresponsive, not breathing, they've suffered some sort of heart attack. This is why it's important to check for a pulse. Because if they're not breathing and they have no pulse, it's a cardiac emergency. Right? We treat that first. We got to get that heart pumping again. And by doing those compressions, if there is something blocking that airway, it'll often cause it to pop out. Just like doing abdominal thrust. So, unconscious, I know I'm stressing this, but I want this to hit home. Walk into a room. There's an infant or a child there that's unconscious, unresponsive. Still checking the scene. I'm still checking them for responsiveness, breathing, pulse, all that good stuff. But if they're unresponsive, not breathing, I'm going to provide 2 minutes of care first before I call 911 to see if I can get that object out. If it's an adult, it's a cardiac emergency, right? Unresponsive, not breathing, no pulse, cardiac emergency. All right, let's move on. Definition of adult, child, or infant. How do you determine the difference between the two? And I like this new classification. The old one was based on weight. And that's really hard to look at somebody and say, all right, that's how much they weigh. So I'm glad they changed this. For an adult, if it looks like they've gone into puberty, that they're through puberty or above, we classify them as an adult. That's for the skills. What skills are we going to use? If they're between 1 year and they haven't gone through puberty yet, we're going to classify them as a child. If they're less than 1 year, still in that infant stage, we classify them as an infant. So, just a rough idea, a lot easier to try to determine if they're an adult, child, or an infant based on this classification than the older method that used to be taught. So let's look at the actual skills of CPR. And I'll have a video for you showing you how to do this, because it'll be easier to see the skill than to listen to it. But at least you can understand the key components in this lecture. So chest compressions. You want them on a flat, firm surface. We don't want them on a bed, anything soft. We need them to absorb all of that compression so that we can compress the heart enough to force the blood out. If they're on a bed, they're going to sink down into the bed when we do the compressions, and we're not going to be able to compress the heart enough to pump all the blood out of it, or as much as we can. So therefore, we're getting even less blood pumped out to the tissue, which could be a problem. So they need to be on a flat, firm surface with no give, so their body absorbs all of the compression. Hand placements need to be in the center of the chest. In the past, they would show you how to find the xiphoid process and go 2 fingers above that. They don't teach that anymore. People were taking too long doing that. Heel of the hand, center of the sternum, center of the chest, that's where you're going to do your compressions. Adults, or even a large child, 2 hands. Small child, you could use 1 hand. Infant, you're using the pad of 2 fingers to do the compressions. Depth, for an adult and a child, 2 inches of compression. For an infant, 1.5 inches. And then for the rate, we're doing about 30 compressions in 18 seconds. So there's a video online, the guy from The Hangover, and he actually used to be a doctor. Anyway, he's doing hands-only CPR. He's not doing the rescue breaths. And he's following along with the beat of staying alive. But you want to make sure that you don't go too slow, because we need to make sure we pump enough blood. You don't want to go too fast, because you're not getting enough blood pumped out of the heart, because you're not doing a full stroke. So 30 compressions in about 18 seconds is what you're looking for when you do your compressions. I'll try to demo that in the video. So your rescue breaths. You need to make sure you do the head tilt, chin lift. If you don't do some sort of head tilt, chin lift, and there's a couple different ways to do it, and I'll show you in the video, the tongue can fall back and close off the airway. So by doing the head tilt, chin lift, it'll open up that airway so that the breaths will go into the lungs. And as you do those, you want to look down the body. So look towards the body, not up towards the head. Kind of lean your head over as you're doing the rescue breaths. And look for the chest to rise out of the corner of your eye. So that should last about 1 second. So you should see the chest slowly rise. So your breath should last about 1 second. You don't want to overinflate the lungs. That can cause gastric distension. So if I'm much larger than that person, I'm going to watch, and when the chest rises and stops, I'm not going to continue to try to inflate the lungs. So I'll do a breath that lasts about 1 second. Watch the chest clearly rise and let them exhale. Because the air is going to go to the path of least resistance. So if you've got the nose pinched and you've got your mouth around theirs doing the rescue breaths, the only other place that air can go, if you give too much, is into the stomach. And when that air comes out of the stomach, it's going to bring stomach contents with it. That means the stomach acid. And if that person aspirates on that, it will damage the lungs permanently. So that's the problem with the gastric distension. It's more likely to happen with an adult giving rescue breaths to an infant or a small child than it is adult to adult, but it can happen either way. So watch this video about CPR and answer the questions on your lecture notes. So airway obstruction. Now we're getting into conscious choking, and the skills are similar. So airway obstruction. So you have a limited obstruction, so you still have some air passing. I may be able to get a small amount of breath, but it's still respiratory distress. And then there's severe obstruction, where it's completely blocked the airway. And so the universal signs of choking is somebody clutching their neck. And so that's an indication that somebody is choking. Or if you need to let somebody know that you're choking, you would clutch your neck, and I'll show you in the video. So conscious choking care for adult or child. Got to get consent, and you're going to do abdominal thrust. This is like the Heimlich maneuver. You're going to take the pad of your thumb an inch above their navel and do abdominal thrust up towards the diaphragm. You can do it directly as an angle towards the diaphragm or a J motion. But you're not going in towards the intestines. You're going up towards the diaphragm to help press on the lungs to pop that object out. For an infant, you're doing 5 back blows and 5 chest thrusts. And you just keep repeating, always keeping the head lower than the chest on the infant. That way, if the object does come out, they don't aspirate or breathe it back in. Unconscious choking. All you're doing is CPR, but you're looking for an object after compressions. So you do your compressions. After that, head tilt, chin lift, look for an object. If you see one, go from cheek to cheek with a J motion with your pinky finger to try to scoop it out. Don't just do a blind finger sweep, meaning that you're just poking your finger around in there, feeling around for it, because you might poke it back down the throat. And then if you get the object out, attempt your 2 rescue breaths. If they still don't go in, you know the object's still in there. You repeat with compressions and keep repeating that sequence. Compressions, checking for an object, attempting to remove it, rescue breaths. Compressions, checking for an object, trying to remove it, rescue breaths. Keep repeating that. Alright, so here's a big one. And there are some books out there, you may even have the book, that tell you not to check for a pulse. And the reason they promote that is because a lot of people take too long or do it wrong. So you use the pad of 2 fingers because you have a pulse in your thumb. So here's a situation. somebody goes through, they check the situation, they check the victim, they check them for breathing, and as they're doing that, they're checking for a pulse, but they accidentally use their thumb or think that the victim has a pulse when in fact they don't. So the logical next skill that you would give would be rescue breathing, because you're saying, okay, their heart is beating, and you give them rescue breaths. But the problem is, they made a mistake. They used their thumb, they were feeling their own pulse, or they thought they felt a pulse, so they did the wrong skill. That's why some organizations say, don't even check for a pulse. If it's an adult, you assume that they are having a cardiac emergency, and you just do CPR. Here's the problem with that. If you start doing compressions on a heart that is pumping, as it's trying to fill up with blood, you can put that person into cardiac arrest. Just get really good at checking a pulse. Pad of 2 fingers, carotid artery, or radial, brachial. Carotid is more common for an adult. Practice on yourself. Do it a lot. It's a skill that's easy to practice. Do it when you exercise. Get really good at it, because it tells you a lot of valuable information. And you don't want to do any further harm to a victim. You don't want to think and just assume they don't have a pulse when in fact they do, because then you could make their situation worse. So for this class, we're still going to check for a pulse, and I'll make a video on how to do that. You can also Google it if you want to look at other methods, but the most common way to check for an adult pulse is carotid. Radial is common for exercise, and brachial is normally used for infants.